2020 regular but remote meeting of the Burlington Board of Health to order. It's been over 6 months. Who would thought that we now have been meeting remotely, and we look forward to face-to-face. 6 months. Board member Libby Wallenjevich will represent everyone in reciting the Pledge of Allegiance.
Thank you, Mr. Chairman. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. I'm Ed Weiner, and I'm chairman, and I am joined by Vice Chair David McSweeney, members Dr. Wayne Saltzman, and Libby Wallenjevich. Also with us this evening is Susan Luminello, who is the Director of Public Health, Christine Mathis, our environmental engineer, Sarah Kodamash, who is our Board of Health Administration and our IT host this evening. And last, I want to thank BCAT and all their professionals who work so hard to make this public meeting possible. I'm assuming that BCAT is on the line. Sarah, Sarah is nodding. Thank you so much. We are operating in a declared state of emergency with special rules, as we have done in the past. Mr. McSweeney, the Board of Health Vice Chair, will provide the legal requirements for this evening.
Thank you, Mr. Chairman. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 20, and the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Burlington Board of Health is being conducted via remote participation. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in this order. As a reminder, that persons who would like to listen to or view this meeting while in progress may do so by tuning into BCAT Government Cable Access Channel, the BCAT Government Meeting Facebook live feed, or over the phone at 408-418-9388, meeting number 173-496-6526. That's 408-418-9388. Meeting number 173-496-6526. Also, we will be monitoring the comments on Facebook Live to see if there are any that the board may wish to address during the meeting. And as a reminder, all votes are required to be done by roll call. And with that, back to you, Mr. Chair.
Thank you very much, Mr. McSweeney. Again, please note that we are live on BCAT and available for comments and questions through this video technology. Everyone, remote meetings and chairing remote meetings are not easy. Preparation in these difficult times are very hard compared to in-person get-togethers. We're looking at monitors. I may not be able to see who is speaking. There's no ability for nonverbal communication. We are doing the best we can. Thank you for your understanding. We will go to the minutes of July 28th, 2020. I'm going to ask that we postpone those minutes because, as a famous politician in Boston once said, as long as you spell your name, they spell your name right. And my name is misspelled throughout the document, so we're going to postpone them so they can be corrected. I've only been here 32 years, so they'll get it right. So anyway, so I got a motion to postpone the minutes, please.
So
Second.
Second.
I have a motion by Dr. Saltzman, second by Libby Wallenjevich. David, all in favor? David?
Aye.
Dr. Salzman,
Aye.
Libby Wallenjevitz,
Aye.
and I vote aye, 4-0-0. Thank you so much. The next we have citizens' time. Is there anybody on the telephone, on this call, on this Zoom, on this whatever, WebEx, that would like to speak to this board at this time? Ms. Kortemash, do you have anything?
I don't see anyone on the call.
Thank you so much. That we will move on. Chairman's report. I have modified what I usually say a little bit, but we are still in extraordinary times. But we're getting there. COVID-19 cases are not what they were in Massachusetts, in many cities and towns that we had in the beginning. We are in Burlington in the green, in the state COVID map. So we're doing well here in this community. We continue to face many never be seen challenges, but this Board of Health is meeting all of them head on using innovative plans that we developed well before this pandemic. I'll note a few things that we have been doing. In addition to all that we have needed to do to keep this town safe, we continue to perform all the duties of a public health organization, and that is town development, including drainage, sewage, site plans, subdivisions, environmental issues, and inspections. And we'll talk about tonight, this coming Saturday's Household Hazardous Waste program. Health inspections, biotechnology, permitting, and communicable diseases review and actions. Our Volunteer Medical Reserve Corps not only has assisted us in so many ways, we've attended so many public health meetings and teleconferences. I have, and we all have, many daily discussions. I speak to the school committee and school leadership almost every day. We've responded to scores of complaints involving the pandemic, and we will hear about some of them tonight. Taken so many questions from the town's citizens, and yes, the Burlington Board of Health has been and continues to be very busy and in the forefront. I want to thank everyone who has done so much for our community. Now, although we have a small agenda tonight, we all thought it would be important to provide the town public updates and provide an opportunity to answer any questions that people may have. So if you're watching this program, this meeting, and you'd like to ask a question, feel free to call in. From there, I have no subcommittee reports. Are there any subcommittee reports from anybody? Hearing none, we go to discussion, which is COVID-19 updates. Our Director of Public Health, Susan Luminella, would you please lead this discussion?
Sure. So I'll provide a brief update on what's been happening for the last 2 weeks since we last met. So as Dr. Weiner said, Burlington is currently green. We have an average daily incident rate right now per 100,000 to 1.29, and a percent positivity in the last 14 days of 0.55%. We have been working on school reopening. We assisted the schools with a parent guide on COVID-19. This guide explains isolation and quarantine and what a parent can expect should their child or someone in their child's class test positive. In collaboration with Dr. Eric Conti, we created a risk communication plan so that we can have templates to utilize should we have a confirmed or probable positive COVID-19 test result in a student or staff members. We conducted a review of the information provided by the schools on the HVAC system and air quality. I just want to note that the Board of Health does not approve the school's plans with regards to air quality. However, it's important for us to have knowledge of the reports and provide assistance and guidance if needed and if it's applicable. With regards to governor's orders and regulations, on August 18th, there was an order amending the administration of penalties issued pursuant to COVID-19. This order allows for the issuance of fine under the non-criminal disposition. And currently, the Department of Labor has drafted regulations on the COVID-19 standards that will incorporate all of the many standards for varying sectors into one regulation. These regulations outline a joint enforcement authority between Department of Labor and local boards of health. One thing that's important to note that I want to let businesses know, that it's required that you report any known cases of COVID-19 to your local board of health. And we do get those calls and we try to answer questions, but it's important for us to know any cases in a business. On August 7th, I'm sure you probably already know this, the gathering order was revised. So changes included lowering indoor gatherings to 25 people or 8 people per 1,000 square feet, and outdoor gatherings to 50 people or 8 people per 1,000 square feet. These changes also include making the order applicable to private venues and locations. This includes private homes, backyards, and parking lots. With regards to complaints, in the past 2 weeks, we have investigated 14 COVID-19 related complaints, 1 for sanitation issues, 2 related to the travel restrictions, 3 related to face coverings, and 8 related to no social distancing. So we're continuing to provide assistance to all public and private entities seeking guidance on how to comply with COVID-19 standards and governor's orders. We're continuing with our contact tracing and case investigation, and providing guidance to any companies or businesses whose employees have tested positive. That's it for my update.
Thank you very much. Before we take questions, and we'll have plenty of opportunity for questions, does any of the board members like to speak or have anything to add to our director's report? Dr. Salzman, did you wave?
Well, I guess, Mr. Chair, I'd be remiss if I didn't continue to carry my torch about, regardless of the fact that we are in the green, that maintaining standard precautions, including hand washing, wearing of masks, and social distancing clearly are paramount. And I would be lying if I didn't say I was a bit nervous after our holiday weekend to see what the potential ramifications are going to be across the country of folks who did not carry on those very basic and what should be now rules of thumb about normal daily life. So I commend our town on continuing to advocate for its citizens, and I commend our citizens for continuing to advocate for each other. And I hope that that this continues, especially as our children are going to school and the weather is going to be turning colder. Oh, and if you hadn't thought about it, please, please, please prepare yourself to get a flu shot this year. I was amazed to learn from recent CDC data that only 45% of Americans got the flu shot last year. This year, more than any year, we need to do much, much better. So please, please consider it when the opportunity does come up. Thank you, Mr. Chair.
Thank you very much. Does anyone else have anything else? Well, I just want to note that there is a subcommittee now that has been formed between the school committee and the Board of Health. And both Dr. Salzman and I will be joining that subcommittee. Our first meeting will be September the 17th in the evening, and we will be looking for all kinds of successes within the opening of the schools, or if there are failures, we will be there and representing this community along with the school committee. So I wanted to point that out. A lot's going on this in the background, and so much so much is being done to try to keep this as safe as possible.
Hey, Mr. Chairman,
Yes, please.
just I guess more of a comment or maybe a recommendation. And I'll take the direction of the chair on this, but I think it would be good since the schools are opening, I believe the 14th is the first day of school, that
Yes.
maybe we do have an update on our next Board of Health meeting from either Dr. Conti or somebody from the school committee on the agenda for the second Board of Health meeting in this month. It would be good just to keep in touch with them and have an open dialogue on how the first 2 weeks went.
We will work that out. The school committee and school leadership meet the same time as this Board of Health meets. But I will speak to Chairperson Christine Monaco, who's been very, very helpful, and she has been so busy. And I speak to her every single day. I'll see if we can work something out to maybe move a meeting a few minutes one way or the other to accommodate that report. So good idea, and I will do what I can to make that happen. Thank you.
Thanks,
Mr. Chairman,
Yes,
Mr. Chairman, a clarification, school starts on the 10th, Thursday.
school starts on the 10th. Okay, thank you. That's great. Very good. I will speak to Christine Monaco tomorrow. She's working very hard, and I'm sure we can work something out. So thank you so much. No other comments about COVID-19. Let's move on to our staff reports because there's so much else going on. As I noted, that the board not only is involved in COVID-19, but there's so much else that we are responsible for within this community. So the first staff report is the environmental engineer, Christine Mathis. Ms. Mathis, would you please give us a quick update? I know everybody has some questions for you, especially what's going to happen this Saturday.
Sure. Hi, thank you. Good evening. Just a mosquito update. Burlington remains at low risk for West Nile virus and remote risk for Triple E. There has been increased trapping and aerial spraying for Triple E this season because it's thought that last year was the beginning of a 2 to 3 year cycle for higher Triple E infections. Both mosquito-borne illnesses are a risk until the first hard frost, which is usually sometime around the end of October, beginning of November. So people should stay vigilant about outdoor activities, especially during dusk and dawn, using repellent and wearing long pants or sleeves as weather permits. And also eliminating any standing water in their yards where they may be outside inactive. And as you mentioned, Mr. Chairman, household hazardous waste is being held this Saturday, September 12th. We are, this is new for us. We've not done one during a pandemic before, and we're attempting to ensure that this is a safe event for not only our residents who will be bringing household hazardous waste to us, but also for our staff and volunteers that work the event. We have put several precautions in place that we ask everybody who is attending to follow. And I'll just go over those real quick in case people are planning on attending. Please do not attend if you are ill or have any COVID-19 symptoms. You'll be required to wear a face mask while in your vehicle. You'll be required to remain in your vehicle with your windows closed at all times. You should place your household hazardous waste in the rear of your vehicle, whether that's your trunk, truck bed, or the rear part of a hatchback or SUV. And we ask that you don't place any non-waste items commingled or in the same space as the waste items so the waste can be easily identified and removed. With that, I'll take any questions about my report.
Does anybody have any questions for the environmental engineer?
Mr. Chairman, if I may.
Please.
Just a quick, maybe you can provide an update or where we are. And I think it's 101 Middlesex Turnpike, and I could be wrong, but it's in your report. But the parking lot at Wendy's / Staples, that whole thing there, have you reached out to them?
I put a call in today to their attorney. I have not heard back. Actually, no, it was Friday. And I also went by the facility a couple of times, and the puddle is actually gone.
Oh, wow.
Conditions are not good. However, it's, the parking lot's a mess. They need to do some cleaning, and I was able to get going through the weeds, if you will, a decent look at the level of water in Vinebrook right now, as opposed to the level of stagnant water in the detention basins. And it looks like that there should be able to be some work performed out there to get those basins functioning again. It looks also like they have to do some possible repair to a catch basin within the parking lot itself. But I'm still working on that.
All right, great. Again, I know it's probably a long-term solution, but if in the short term, it sounds like either they cleaned it or maybe because it's just been such dry conditions. Like I said, when I was there, it was a mess.
I think it's a combination of that, and they maybe it looks like somebody put it like an intentional small trench from diverting the water back towards the catch
Gotcha.
basin and away from the parking lot.
Okay.
So I'll
Thanks for the
continue to update you as I progress. Yep.
Thank you.
Anybody else? I have a couple. Libby, do you have any? Or yes, I have one of which is our Birch Street subdivision. Will that be on our next meeting? And that will be the 22nd. Is that what the target is for that subdivision?
That is, was on the weekly department coordination meeting, and there is still an issue at hand between the planning board and the applicant about whether or not that subdivision can actually exist. So I have them on the agenda for the September 22nd meeting, but I'll know more in the next couple of days. So they'll either be attending that meeting, a future meeting, or coming off entirely if it's ruled that it can't be a legal subdivision.
Thank you. And then one more. If people come to Household Hazardous Waste Day and they have material in the back seat, will we accommodate them?
No.
If people come without a mask, will we hand them a mask, or will they have to turn around and get one?
I believe we will have masks on hand.
And so we will be turning away cars that are not complying. Is that correct?
Yes.
And
We don't want our, I'm sorry.
Yes. Please continue.
We don't want our staff or volunteers to have to enter the front seat of a car or the back seat of a car to get materials out, because then they're within 6 feet of the person that's occupying and driving the car.
And last is for the volunteers who may be watching, as well as people interested in our coordination of the program. We have increased signage. My concern is when people get up to my spot, and this is my 59th, my 59th Household Hazardous Waste Day. People like to get out of their car. Do I have a sign that says, "Don't you dare, please"?
I don't think that's the exact wording, but we certainly have signage that says "Remain in your vehicle." Both our standard signs with additional placarding, with our additional warnings that I just read, and we're also going to deploy handheld signs as reminders for people, roll up your window, or stay in your vehicle, that type of thing.
Sarah, thank you so much, Sarah. I heard the other person making them. Sarah Kodamash, thank you so much, our administrative person. Please give me a sign that says something rather harsh. Stay in your car and don't, or something of that sort. Thank you. Thank you very much. Anyone else have any questions for our environmental engineer?
Sarah, I think his sign should say, "I am older than hazardous waste." Please respect. Please,
I think, and a second one that says Dr. Saltzman is catching up.
yeah, look at the gray.
I might add that there may be some truth to that because the hazardous waste regulations went into effect after Dr. Weiner was born, I'm sure.
There you go. That's what I'm saying.
My first one was in 1989, but I'm not going to tell you how old I am. Anyway,
I make a motion to accept the environmental engineer report with thank you.
Second.
I have a second by Dr. Saltzman. Motion by Dr. Saltzman, second by David McSweeney. I'm doing this because it's going to be our minutes are going to be transcribed from this recording. Any other discussion? If not, all in favor. Dr. Saltzman says yes. David McSweeney,
Aye.
Libby Wallenjevich, and I vote aye. Thank you. So you voted aye, Mr. McSweeney?
I did.
Okay, so 4-0-0. Thank you. And next staff report is the Director of Public Health, Susan Luminello. Susan, do you have anything else?
Yes, I just wanted to update the board on what we were doing around flu. But before I do that, Mr. Chairman, I believe somebody joined on the line. So just so you know, I believe it's a caller.
Through your
You're on
report.
mute. Okay. Okay, so with the flu, so I did speak to Dr. Saltzman regarding the timing of the flu and or when the flu vaccine should be giving out. And his direction was to try to make it later if we could, mid to late October or end of September, beginning of October through October. So looking at our schedule, what we wanted to do was provide drive up option. So drive up, get out of your vehicle, come in, get your vaccine, go back to your vehicle, and have appointments for doing that. So our plan is to do that type of flu vaccinations beginning of October, around the second week of October, for first responders, for town staff, and for our high dose, for giving out the high dose. So we started taking people's names for the high dose. Go ahead, Dr. Saltzman.
So, Mr. Chair, before the director continues, I want to make sure that my considerations were understood. They weren't random in thinking. So there has been a lot of chatter back and forth, especially now that pharmacies are advertising that they have flu vaccination, that they have flu vaccine, to get flu vaccinated now. So as we all know, the flu season kind of officially starts around Thanksgiving and can go through April and often into May. So my concern, and I'm not alone, the infectious disease specialists are discussing this as well, that in order to build a good immune response and have that immune response to carry through to throughout the period in which the flu is endemic in the United States, would be best to get the flu shot somewhere around mid-October. So so that's the major reason. Make sure that we have good immunization and that the immunization carries through the flu endemic. The lesser issue is, of course, making sure that we have flu vaccine. And of course, everybody is talking about flu vaccine and making sure that the majority of Americans receive it. We haven't received it yet, but I don't know when we will, but want to make sure that we're ready to administer appropriately when we do. Thank you.
Thank you very much.
Thank you, Dr. Saltzman. So we've also been looking at a drive-through type of model as an emergency dispensing site option. And we began work on a plan and have looked at a couple of sites. And I believe that the high school is going to work out best as a site as long as we can get the entire campus. So we will need to use every area of the high school, and we can't have cars coming in at the same time. So I need to make sure I get a guarantee from the schools that all other events will be canceled on the day that we are planning on having the drive-through. So I did reach out to Dr. Conti. He's checking some dates for me. I'm trying to go with October 17th. That's the date that I would like to go with. He is checking that date out just to make sure that nothing else is going on at the high school. We're also going to need help from other town departments, especially when it comes to supplies. So we'll need mainly tents and generators. So I reached out to several departments and several have gotten back to me saying that they have tents that we can use. The schools have 20 by 10, two 20 by 10 tents that I'm hoping to put in the area where we're going to be doing the dispensing, have the cars drive right underneath the tents, and people will come out of their cars, especially if they're a family, sit down, get their vaccine, get back in their cars, and then drive off through the rest of the drive-through areas. So that's what we're looking at now. We need to make sure that we have a few things that we have to have. One is we have to have the entire school parking lot. We have to have the equipment that we need, the tents and the generators. We have to have the volunteers willing to come forward and help us. So I will be sending out a message to all the volunteers, seeing how many would be willing to work at a drive-through area. And then the equipment, need to have the equipment. So we're working on that now. We're working on a plan, and I'm hoping to be meeting with staff. I will be meeting with the police department so that they can look at the drive around plan, because we're going to need their cooperation and their help as well. And I will provide, updates at the next meeting, and I'm hoping we can get it all together before then. But this is the model that we would use if we had to give out COVID vaccine, because we just cannot do the regular EDS type of thing that we've always done, mainly because of the gathering order. You just can't have that many people indoors all at once. So with that, I'll take any questions.
Does anybody have any questions for our Director of Public Health?
Director, will we have the ability to do kind of a mock I want to say mock test, but I think that's redundant. Is there going to be kind of a something to make sure this all is actually doable with tents all set up and everything?
We could think about it. I just don't know the amount of effort and that would be required and set, especially the bigger tents, because those two 20 by 10 tents would have to go they all have to go in the driveway areas of the high school. So the way that we have it set up now is, we have stations in the front where you get, which would be the registration and the medical screening. And then you drive up around to where the cafeteria doors are, and that's where the two big tents would be. So I can ask them about, can we try to look at what the setup would be, or perhaps maybe setting up a day before or a couple of days before, just to see what the setup would look like. I'm not sure if the schools would be willing to do that, though, considering they have school going on. We would have to get them to set up that morning or maybe late Friday. The thing I'm concerned about, I want to make sure too, is that there's no sporting events and things like that going on as well, because these tents are going to be like right in the parking areas and things like that.
Maybe not
So,
tents,
I
but
mean, I guess we could try it. Huh? What?
Maybe not the text per se, then, as you said, but maybe outlines of where things will be. So at least we could have an understanding of how flow will look in real time.
Yeah, I mean, right now we have, we're working on diagrams and traffic patterns. So I will put those in my next report so all the board members can see them. And then maybe we can get comments on those as well. We're supposed to be meeting with the police hopefully this week or next week to get their feedback on the actual, what the plan would look like and the way the traffic would go. So yeah, we could try to do like a dry run, try going through actually where everything is gonna be, type of thing. All that stuff needs to be in our total plan too, so we're still working on that.
Director, I have two questions. One, will this be a medical reserve corps drill? Will we be calling it a drill this year?
Yes, yeah, it'll be a drill. It'll be a drill for drive-through EDS.
Thank you. And one other comment before my other questions. I had a long talk today with Mr. Sagarino, the town administrator, who is such a great supporter of the board, and he is such a great professional about police, fire, and the other departments, and as well as additional funding. And he was very open for all of those discussion points and told us this is a very important program within the community, and he's willing to support us in any way possible. We can talk about that in another meeting. And last, we had a single situation where you had to call the Department of Labor about a corporation within the community that was not following the guidelines. How did that work out?
So I'm not sure exactly. I talked to them a couple of times. I'm not sure which one you're referring to.
Oh, we talk twice a day. One specific one that they have employee or employees who commute back and forth weekly from Florida, who had refused to register and to quarantine or to have testing. Where did we go with that when they told us that they would not do it?
So that was the travel restrictions, and the challenge there was finding somebody at the state level who could answer questions regarding the travel restrictions. So what they had told us was this person comes to and from Florida every week and a regular basis, and therefore it's not subject to the travel restrictions because it is more akin to commuting rather than traveling. So I was able to get in touch with someone at an attorney for the Department of Public Health and was referred to her. And she basically, that's what she said. She agreed with them, saying that because it was regular, because they were coming every week, that it's commuting and that they did not have to get tested prior to if it was for commuting. So that's the understanding that I have from them right now. That's the information that they gave us regarding commuting versus the actual travel restrictions. We've had a couple of complaints regarding the travel restrictions. We've had other complaints where like a manager might come in from, as a one-time thing into a company, just to, I don't know, for a business meeting. That is not considered commuting, and they would need to adhere to the travel restrictions for that. So I'm guessing that the way they're differentiating it is if it's on a regular basis and you're coming all the time across the border for your work, regardless whether it's by car, train, or plane.
Saying from a hotspot within the community, someone is coming in weekly and doesn't have to. It's just unbelievable. Just unbelievable. Typical of the Massachusetts Department of Public Health.
I am not in favor of that consideration at all for everything that we know and have learned thus far. So I would wow. I would just argue, not argue, I would suggest to our citizens who are really working very hard to make sure that they are keeping safe, and by their doing that, that their neighbors are keeping safe, that if anyone hears of anything similar to this or there are any concerns, please reach out to us, because if we have to do one-offs over and over and over again, we will. But I'm very concerned about these precedents that are being set that really do not make sense, and truly do not follow CDC guidelines. So I'll just put myself out by saying that I do not agree with that recommendation in this case.
It, there are so inconsistencies when you're dealing with that organization. Uh, I'm sure our director can tell you my frustration over the years with them.
Well, I laud our director for her efforts in trying to maintain the health of our community, but issues like this really do put a monkey wrench into her ability to do so. So thank you, Director.
Thank you, Susan.
Yes, and I would agree with that. And what I try to tell people too, it's about doing the right thing as well. So somebody, maybe there is no enforcement capability on that type of thing, but should they really be doing that and commuting like that and coming into an environment here? So we hope that everybody does the right thing as well.
I mean, the board has always been very fair with understanding the needs of our citizens and the needs of businesses and trying to balance those out. We are known for those considerations, but this is something different. I get the need to work and to be employed, but this is still something different. And I don't know the nature of the work, but I know that remote does work. So for many businesses. So I don't know what else to say on this except that please let the Board of Health know about any situation similar so that we can help make sure that everybody is safe. And while I have the floor, Mr. Chair, if I could please, um, uh, regulations were altered this year regarding the ability of pharmacists to give vaccinations. Pharmacists can give vaccinations, but the opportunity to do so has been extended by the state. And so, if there are any pharmacists in the town of Burlington who wish to be part or who can be part of our medical reserve corps and actually participate with our drill, he or she or they would be very welcome. The vaccinations do not need to be given by, medical personnel in the strictest sense anymore. We have other opportunities, and I welcome any pharmacists in our community who'd be willing to step forward and play an additional role in our community. Thank you.
And we have always had pharmacists who worked at our Medical Reserve Corps programming, especially during the flu vaccine program, and they have been outstanding. So thank you very much. Just one other question. We've worked very hard to keep this community safe without people who are coming from hotspots weekly to this community without getting testing or without doing what they need to do. We keep hearing on teleconferences that we can pass rules which supersede the state, make them more harsh, or can we do that in this particular situation? I mean, I just find it incredible that we have people coming in from hotspots around the country and don't have to quarantine, don't have to be tested, and intermingle and come into our stores and our restaurants, and we can't do anything about it. I just, we hear so much from the Massachusetts Department of Public Health. Many times I can't answer our questions, but this is just horrendous. I hope that if BK, they pick this up anyway, or the patch pick this up.
I mean, even if it's something like getting a, as many businesses are doing and the schools are definitely doing, having either a rapid antigen test which will be and I don't know what happens in Florida. I'm not sure what is going on there with regard to testing, but either having a rapid antigen test 24 hours prior to flight, or getting a weekly molecular test, which would take a while to come back, but at least there'd be an understanding of where things are. Especially this is a weekly event, but I would have no problem with anybody going back and forth as long as they were doing something responsible, like getting regular testing in order to make sure that they're safe to do so. Just saying.
Okay. Maybe we need to pursue this. I'll talk to our director. Are there any other questions for the Director of Public Health? If not, do I have a motion?
So to accept.
Second.
Dr. Saltzman, second. David McSweeney, all in favor. Dr. Saltzman,
Aye.
Mr. McSweeney,
Aye.
Libby Wallenjevich,
Aye.
and I vote aye, 4-0-0. Now, is there somebody on the line, Sarah, who would like to speak to the board, or are they just watching and are interested? They're welcome to make comment. They're welcome to ask a question.
None that I can see at this time.
Okay, let me say this. If people are tuning in, and I know this will be on Facebook in the next day or so, this meeting. If people do have questions, they're welcome to call the Board of Health. We're very happy to answer those questions or pursue them if we need to, and speak to them if they have comments. I've done this over the past week, and I know our director and our environmental engineer has done it many times. So I just want to put that out again, and we did have people who took with that offer. So we are here to help you and to answer and to do what we can. Is there any other discussion from board members? If not, I just have a couple of closing statements, and that is we meet September 22nd is our next meeting. Between then and now, I want to wish all of our Jewish citizens of Burlington and the community a wonderful and happy New Year. I want to say and express that we were doing whatever we can to keep you, your family, your friends safe within Burlington. And I want to say thank you for all that you're doing to help us help you. And with that, do I have a motion to adjourn?
So moved.
So moved. Second.
So I have a motion by Dr. Saltzman, second by Mr. McSweeney. All in favor? Dr. Saltzman,
Aye.
Mr. McSweeney,
Aye.
Ms. Wallenjevich,
Aye.
and I vote aye, 4-0. Good night, everybody.
Wash
Be
your
safe.
hands. Take
Be
care.
well. Wash
Good
your
night.
hands.